what efforts we have and do as much good as possible. We can't do it by ourselves. We need everybody we can. So part of this Zoom meeting is to help get the word out to you guys of what we're doing and get your input back to us, because I think that's very important as well, and get this whole thing started. So anyway, we'll start in a minute or two, and we'll give people just another minute or two to get on board and get going. So. All right, I think we've got most everybody on. For now, we'll have a few stragglers. That's fine as well. Our last Zoom meeting, we had Mr. Farrell from Foster Farms. Very good description of what Foster Farms has been going through and their struggles, the things they've learned. Very interesting to me. I've had several good comments about it. One of the things I took away from that was that he mentioned that for every symptomatic employee they found, they had 4 to 5 that were asymptomatic. And the only way they were catching them is with a very aggressive employee testing program. And their positivity rate was hovering around 1%. Well, the positivity rate for our general population is much higher than that. So they're successful, but it comes with a price and it's a struggle. But I thought that was very interesting. If you have a question or want to talk with some of our county staff, they're very willing to help. We do have a couple of email addresses. If you just have questions about your testing, your plans, what you want to do, an outbreak. You can reach out to covidag@fresnocountyca.gov, or if you have testing questions about testing, you could reach out to COVID Testing at fresnocountyca.gov as well. Our guys are busy, but they will get back to you and they will offer help and guidance as best we can. Whatever we've got, we're willing to share and get that to you. Anyway, any questions like that? Like I said, be a little patient. Everybody's busy with this right now, and it is very important. Another thing I wanted to bring up, and I know Melissa's on the line, so she can correct me, but we are getting some PPE from the state. She's gotten, their shipments are supposed to arrive, if they haven't arrived already, shortly. It is, the idea is to get this out to our farm worker community. Melissa is the main contact for that. Her number is at the Ag Commissioner's office is 600-7510. But have you gotten the PPE started to come in yet, Melissa?
Yes, and one thing I do want to add to that is that CBOs and industry groups should contact me directly. If you have members that need stuff and your group doesn't want to hand that out, go ahead and ask me who is the appropriate, because we are not doing any direct distribution at this point to growers. So, okay. Don't say, oh yeah, just call the Ag Committee, because there's going to get bounced around and people are going to get frustrated. The only thing that we are, surgical masks, we are providing to like large packing houses and whatnot. But again, if a grower needs a box, most of that stuff is going through Fresno County Farm Bureau, and Ryan's on the call here, I see. But if you are a CBO or an organization that wants to hand out PPE, please contact me. This week I did, at least we haven't verified that all of it came in, just because we were supposed to do that yesterday afternoon and the warehouse had to cancel. But I'm pretty sure that we have about 75,000 bottles of hand sanitizer, and those are large ones, not like travel size or whatever. I believe 600,000 cloth masks, and I think we have about 500,000 surgical masks over there. That was the one number we really weren't 100% sure on, because Mario, who usually deals with checking the stock over there, was only aware of one shipment, but I'm pretty sure we got another shipment of like 500,000 that's sitting over there somewhere. It's a big warehouse. There's lots of different people's products, so occasionally we've got to try and make sure that we locate everything that's over there for us. So if you want to distribute any of that, I do have some orders that I took prior to asking the state for those materials. So I need to fill those first, but I did ask for extra. So, you know, please reach out to me if any of those items are things that you want to distribute, obviously out into the farming community or rural communities, those sorts of things. You know, we're not distributing, you know, in town to residents of, like, say, cities of Fresno or larger incorporated cities. These materials are meant for rural communities and specifically targeting workers that are in the agricultural sector.
Awesome. I know, in talking with several other groups and different meetings and stuff, Fresno County we've been the recipient of a lot of good PPE in that a lot of places aren't getting. So take advantage of it. I think this is a real treasure for us, and let's get it out into the workers and get it in use. So awesome. Thanks, Melissa. Appreciate that very much. As we can't stop working on, we can't stop testing, we can't stop working with our workers, quarantining, doing what we got to do, but we got to, at some point, we got to start turning towards the actual vaccination process. And we're starting to think about it here, and that's kind of what we're going to talk about. When we started doing the testing started out in a doctor's office. The patient had to go in and the doctor administered the test. Over time, that evolved to, now we got people doing the tests, self-administered tests in the field. My point is that this is going to evolve. We're going to get more efficient. We're going to learn, and we're going to need to do that. And so this is a start to that. And I think this is this is where we're going to start today. So we're looking for input on a lot of levels. We've got some ideas. We want to try some things out. Again, we're open to everything and anything, and really want to hear from you guys on that. Joe Prado is with us, and Joe is going to talk a little bit about what our thoughts are. And Joe's the person in charge of the planning and all rolling out of our vaccination process. And so he's got some really good ideas to think about with us and get your input back, of course. And then Dr. Solis is going to talk about if you want to do vaccinations at your site. She's got a checklist for that. And then we're going to talk about some of our outreach materials. Buddy Berber is going to talk about that as well. But we'll start with Joe. Joe, are you there?
Yes, sir. Can you hear me okay?
I can hear you.
Okay, great. So, Sim, if we could go ahead and start the PowerPoint, that'd be great. Well, good morning, everybody. I thank you so much for the opportunity to come speak to you. And really, this is a brainstorming session, really. I really want to present some concepts, some ideas we kind of been throwing around. I just want to have some dialogue in certain sections of this presentation today. So I just really think of it under that type of context of really seeing what we think would work, what wouldn't work, and see how we kind of push forward with this here. And so, you know, before I get started into the detail how it relates to food and ag, I wanted to give you a little more of the whole framework of Fresno County's vaccination distribution plan. So we can go ahead and run it, the slide. Thank you. And so, you know, our whole vision really is that we want to vaccinate Fresno County residents in a responsible, efficient, and effective manner. And, you know, you've got to put some metrics to this. And so we're saying we want to vaccinate 600,000 residents by July 31st, 2021. how did we come up with 600,000? Where are you pulling that number from? You know, it really goes towards herd immunity. So, you know, early on, we're thinking, you know, roughly 70% of our population to get to that herd immunity figure there. So there's 1 million people in Fresno County, 70%, you know, by the time we hit July, right now, I think we're sitting at maybe 60,000 people that have COVID. So we probably more than likely will hit some more people that would get COVID. And so if we could vaccinate 600,000 people, we could get to herd immunity by July 31st, 2021. Now, 600,000 people doesn't mean that's 600,000 doses. So 600,000 people means 1.2 million doses by July 31st, 2021. And that is with currently with Pfizer and Moderna. Both these vaccines require a 2-dose regimen. And so if we take that 1.2 million roughly from January 1st, that's about 5,700 doses a day. We are nowhere near that today right now with vaccination, but we're going to get there. And why can I speak confidently about us getting there? Because we did it already with lab testing. And so when we first started with lab testing in March of 2020, we were about 300 tests a day. The system now is in full running, and it is about 6,000 lab tests a day. So let's not be overwhelmed with the potential 5,700 doses a day. We can get there together, but we need to get there together as a community. Just like we did with lab testing, we need to all come together. This isn't something that's going to be done by the public health department by itself. This is all of us figuring out logistics. This is all of us saying, you know what, I'm willing to step outside my normal box to help somebody else out. And we're seeing that already early on with the healthcare workers. As we're vaccinating the primary care physicians, you're seeing one medical group helping another medical group out with their vaccination. And so I really expect us to be able to do that here in our food and ag community as well. And so I just want to kind of really tee it up a little bit in that this effort here is not going to be on any one's shoulders. It was going to be a shared collaborative effort on really being able to provide a very efficient way to get vaccination to our food and ag community here. And when I said the responsible, efficient, effective, what does that actually mean? Well, responsible, first and foremost, we need to meet the cold chain requirements. The most complicated cold chain requirements we have ever seen is within this particular vaccine. So we need to be responsible in managing that throughout this entire event. And at the same time, we need to be responsible how we move throughout these tiers as well. So as you see, the tiers are developed on the people who are most likely to be exposed to COVID in their normal everyday work, but also the most vulnerable population as well. And so you're going to hear that a lot. You're going to hear a lot about focus on the vulnerable populations. And so that is how we're going to move throughout this response. Efficient. We need to develop a distribution system that really is going to maximize the amount of vaccine with minimal waste. Notice how I said minimal waste and not no waste. I mean, we've managed vaccines for decades here. There is always going to be some level of waste. It's just the way operations goes. But we want to minimize that completely. And so when you hear from Dr. Solis a little bit later, there's going to be some requirements. There's going to be some key things that are very important to be able to minimize that waste issue. Effective. We want to administer vaccines to the population. We want to maximize protection. And that's getting us to herd immunity. And at the same time, at the beginning, we're focused in on that vulnerable population. Next slide. Just a brief update. We're 44,000 vaccines we've received to date. 47% of those doses have been redistributed. What does that mean? They have moved from our freezers to a medical provider. They have moved over, they have been direct shipped to one of our medical providers. We were able to get these vaccines out into the healthcare workers that are able to self-administer the vaccine or actually work with us directly on a daily basis. So today we've got hospitals receiving direct shipments. We have some healthcare facilities that are actually coming in 2 to 3 times a week, picking up their doses and getting folks vaccinated. So we go into the federal state guidelines. So our whole framework is worked around what the federal and the state guidelines are. And you'll hear a lot of this in the community phase 1A, 1B, 1C, and general population. And so the way in Fresno County, when people will actually get vaccine, we're looking at phase 1A, completing that through February, phase 1B, February through March, and the general population, we're estimating from May to July. So what occupations are in those phases? Next slide. And so here's the layout where we see it. So phase 1A, the healthcare workers is approximately 58,000. And so I have a mid-December. So we did get some supplies in mid-December, and I have that going out to February 2021. In Tier 1, the majority of those areas will be complete by next week. In Tier 2, we're already vaccinating home health care. We're already have vaccine out to primary care clinics, FQHCs. We're still working on the in-home supportive services, then the community health workers, and we just started vaccinating public health field staff this week. Tier 3, the specialty clinics, laboratory workers, pharmacy, and dental clinics, we're gonna see those pretty much around late January, going into February as well. So how are they getting vaccines? So if they're able to vaccinate their own staff, and we're pretty much delivering vaccine to them. But some of these other areas like the dialysis centers, we've stood up, in the EMTs, we stood up a vaccination clinic at the Fresno Fairgrounds. And so we're running that today. As of today, we're about a 400 appointment system right now. As we really dial in our registration process and appointment process, we hope to get that up to about 1,600 a day. And so you'll see those numbers improve on those throughputs as we go throughout late January and definitely into February. Phase 1B, and this is where the food and ag industry starts coming in. That's approximately 262,000 people. So just kind of notice a significant increase when we get into essential workers and the medically vulnerable here. And that we're looking at February and March of 2021. Tier 1, so that is a food, ag, education, and childcare emergency services. Emergency services being your police, your fire departments there. You saw last week, you've got the EMTs and paramedics that were vaccinated. There were some fire staff that were vaccinated during that event. And that's what that's going to be really key in our logistics, is that when we mobilize an event and we say it's a 400 dose clinic, we need to give 400 doses out that day. So there's a wait list. And so if there's anybody else that we can bring in to provide a vaccine, we will bring them in to make sure we do not waste any vaccine at all. So you'll see a lot of movement throughout these tiers, where you may hear, hey, somebody 75 and over got a vaccine and they're not till April or they're not till March, right? We're going to see that because we don't want to waste vaccine. It won't be in the large numbers, but you will hear stories of like, I got my vaccine early and I wasn't supposed to get it till March. Well, there's circumstances around that to make sure we don't waste any vaccine. Tier 2, 65 to 74 with chronic disease. So somebody with diabetes, asthma, we're looking at that in Tier 2. Incarcerated individuals, homeless, transportation, logistics, industrial, residential, critical manufacturing. So the way we're going to start communicating with these industries is really through their employers. And we'll communicate with the employers, and the employers will send out a secure link to where their employees could actually sign up and register and get vaccinated. And then we go into phase 1C. So this is the other part of the essential workers and the medically vulnerable. So this is a 65 to 74-year-old that has that is with no that is healthy, and then a 16-year-old to 64 with chronic disease. So now we're dipping into more of the general population, and we're widening out that age gap. And then we're looking at water waste management, defense, energy, chemical, government operations. So technically for me, I fall under the April 2021. I'm not in the field providing direct service. So just to give you an example, I'm going to get in line. I'm going to wait till phase 1C when it's my turn. And I totally plan on getting vaccinated when it's my time to get vaccinated. And then we're going to see the general population May through July 2021. Let me pause there right now and just any questions right now in regards to the phases or any of the other metrics that I've just discussed.
Hey, Joe, this is Beva. And so I am thinking about just the diversity among our farm working workforce, right? Like many of them are not necessarily English or Spanish speaking. So can we talk a little bit about the outreach, how we're letting them know about their priority?
Yeah, definitely. So we're right now putting together this phase table that kind of speaks to these timeframes. And then we have a benefit of having the COVID Equity Project, and that is, they're into their scope of work. They have a health education outreach component. So we're gonna definitely rely heavily on our existing relationship with our community-based organizations to assist in getting that word out. In addition, we're gonna have multiple other media avenues that we're gonna be pushing this information out as well. But definitely as we've finalized this schedule, we'll be getting that information out. And as part of this project here with Food and Ag, that is going to be a key component of every of these models that we're going to be developing, is having education prior to the day of vaccination as well. Okay, I'll go ahead and move on to the next slide. And so this Food and Ag Vaccine Initiative, what we're doing is we're gonna set aside 3,000 doses out of our freezers for the Food and Ag population. And we want to be able to mobilize this by late January. And so by pretty much by the week of January 25th, we wanna test out 3 separate models of vaccination here. I mean, right now, what we're looking at is a closed point of dispensing site. What does that mean? Right now, we would set up areas, gyms in high schools in the rural areas. We would do a wide community campaign and say, Food and Ag workers, here's a time frame for you to slot. Our COVID equity team will help people register them into the system, and they can show up at a gym site that is weekends, evening times. That is one way we're looking at being able to serve our community. That's not the only way. And it's not a one size fits all. And honestly, it doesn't meet the full efficiency requirement that the whole framework we're building this on. And so we want to test out through partnerships with businesses to see, is there a more efficient way to vaccinate our food and ag population? And so these are the 3 models we want to test out. Our first one is we want to work with an indoor facility. And when I say indoor, this is a food and ag business that has workers in an indoor facility. And so why indoor? Because it's a more apt to transmit COVID virus in an indoor facility versus an outdoor environment. We want to partner with a facility that actually has had a COVID-19 outbreak. We want to be able, we totally see that as meeting the vulnerable population. We want to be able to support this potential facility and getting some of their staff vaccinated. And so that's going to be on-site vaccination, and that will be supported through county clinical support. And so through county clinical support, what does that mean? That means it's going to be county staff or our contracted staff. We're looking at bids we'll be receiving by the end of the day today. And so it could be a combination of both county staff or contracted vendors that we are working with. And then the second one is an indoor facility, may or may not have had outbreaks, but we want them to coordinate with a nearby clinic that administers COVID-19 vaccine. Our federally qualified health centers, they are coming on board to be COVID vaccinators. So this whole concept is an indoor facility, basically you coordinate with a local clinic in your area. And so they pretty much will save an entire day, 2 days, 3 days, whatever it takes to get through the throughput of your employees. And they pretty much will manage you together will manage the logistics on registration, dealing with working with the observation periods and doing all of that as well. So that is a more direct relationship with a clinic provider that is in your community there. And so we feel like in another week, we should have more available We have 2 major federally qualified health centers that were approved by the state. We have another one, significant one, that is pending at this time. So we hope in another week we'll have more options. So whoever wants to try this, we should have a federally qualified health center ready and available to service you. And the last one is outdoor workers. And so, you know, this is where, this is the mobile vaccination event. So this is really, if it's going to be, are we going to be out in an almond orchard? Great. Give me a paved area. Give me some sort of cover from the elements, and we'll mobilize some vaccinators and look at what that throughput could look like. After you get vaccinated, we need to be able, we need enough space to where we need to observe individuals for 15 minutes if they have any side effects, if we need to administer any type of epinephrine. So we'll have medical staff on site. So we need to be able to keep people socially distanced and being able to manage that. So that is something I really want us to be able to test that out and see what that could look like. Next slide. Sim, next slide. Thank you. And so in these 3 models that I just mentioned, businesses, you'll help us manage logistics. And part of the responsibility of you being chosen for this project here is that you get to report back to this group, to others, of how it all went, how hard it was, what is some wisdom you gained from being able to do this and manage this, and just report back to all of us on that. Any type of workflows, any type of documents that you create, just kind of assist that and sharing that with your fellow business partners here. That's exactly what the medical groups are doing right now. They are sharing, they are learning certain things of how, gosh, I wish I would have had cones to, you know, line up people a little bit better. I wish I would have had delineators. I wish I would have had more signage. Those are those pieces that that really we want to be able to work with you. And so the selected businesses, they would pretty much be assigned to our COVID planning team, and they're going to work with you side by side. Like, here's the framework. And so we can supplement some of those resources, but we'll need some of your assistance on screening, registering individuals if they're not already registered, making sure we move the line control people, moving people throughout that. So definitely going to look to the business to do the majority of those types of things, but we would bring in with the management of the clinical side. You know, that looks a little different when you work directly with a clinic provider. Honestly, that's just going to be a lot less of a lift. You're just going to be coordinating schedules, and the clinic will do the majority of that work there. The outdoor, that's going to be a logistical ask. We're going to work alongside with you on that. Any businesses that are considering participating in this, understand that you'll need to manage both first and second doses. So you'll get the first 3,000 doses here in late January, and we're going to set aside another 3,000 doses 28 days after. And I say 28 days because we're looking at using the Moderna vaccine. We have more than Moderna vaccine on hand now. So that is a 28 days from the first dose, and that's what we'll be looking. Another reason why we like the Moderna vaccine, it just gives us a lot more flexibility. It can be at room temperature a lot longer than the Pfizer vaccine. So in this initial demonstration projects here, I want to be able to give us the most flexibility. And honestly, the vaccine that's more forgiving than the Pfizer vaccine, it's a very tight window. I believe that's only a 2-hour window versus a 12-hour window with Moderna vaccine being at room temperature. So we're going to match you up with the Moderna vaccine. So really, if you're interested in this, it's going to be the first and second dose. Next slide. And so now I'm going to share my time now. Oh, I'm sorry. Any questions so far right now from the team before we move to Dr. Solis?
Joe, I got a couple questions for you.
Yeah.
First and foremost, 3,000 doses, not going to go very far. And I didn't see no prioritization there as far as specific subsets within the ag industry. So, you know, obviously, I think from an industry standpoint, I mean, we know that the meatpacking plants, I mean, should be at the top of that list, I'm hoping. just because they have had outbreaks. I mean, I know that we're trying to test different things, but also if we have vaccine available, it seems the logical place would be to start obviously working with those partners, and because those are large facilities that have a number of people. In addition to that, just based off of the time of the year, we're lucky in that a lot of ag is slower than most of the rest of the time of the year, with the exception of the citrus industry. And so I would assume that, or I'm hoping that they're at the top of the list as well, working with those folks. Because when you look at the subsets within ag, we talk about ag in this big picture, but those two subsets, I would think that the next 2 to 3 months are going to be kind of at the top part of this, or should be at the top part of this priority list.
Yeah, no, thank you. Really appreciate your comments. So yeah, this right here is just the tip of the iceberg. We want to be able to get these out, see what models work, and we'll have more doses available. And so we just need to know which system we're going to replicate and which one can replicate at a higher rate as well. So, you know, the mobilization out in the area, that's not a 5,000 type of event, right? That's going to be more in the hundreds. If we've got other facilities that can be a higher throughput at thousands, that's something we want to know today, because we want to be able to plan and really make those relationships now, so we can start setting more vaccine aside for that as well.
Cost. Haven't seen any mention of that yet. Where is that being covered? Who's covering that? How's it all going to be figured out?
Yeah, so there is no cost on the county end. We're pretty much going to, when we supplement your staff, we're pretty much, there is no cost for vaccine or our staff. When we send the businesses to a clinic, we are covering that cost with our contracts with that clinic provider. So there isn't a cost for that. You as a business, as you provide those logistic supports, I'm assuming there's a cost associated with that, but there is no cost coming from the county or any of our clinical partners.
And for the mobile and or on-site types of events, just asking from an employer perspective, is there any liability associated with the employer on hosting those types of events, particularly because we have seen some adverse reactions to it? It sounds like the medical providers are going to be prepared for those types of events, but do we as employers, I mean, that's I've gotten that question several times already, does the employers take on liability by doing that on site?
Yeah, so I can speak to medically, every individual, part of their consent, they're consenting to the vaccine and they're being made aware of the adverse effects. So we're being responsible in that we're pretty much going to have the medical personnel available if there is any adverse effects on site at that time. So we've got that addressed and covered. Now, how does that look like in the employer side of it? I definitely would defer to your human resource folks as far as what does that look like as far as liability on that end.
Got it.
Any other questions?
And one thing I should have asked, it's automatic that there is that second dose that's held for that person once the first dose is administered. So we, as an industry, we are planning that. I mean, it's pretty much, how are we going to do this? Because I know your resources are going to be so limited. You said you're going to build up, I think you said, to 1,200 doses a day or 1,300 doses per day. Right. But the assumption is that you're going to plan out 3 weeks and then you have to duplicate that same 3 weeks, correct?
Right, right. So, you know, and this is where I'm at, very comfortable saying 3,000 doses and then a second 3,000 in 28 days, is I'm looking at the amount of vaccine that's being made available to us, looking at our existing throughput. That is extremely manageable. That is something we can definitely guarantee. You know, can we do the 2 doses if we ramp up very heavy? That I don't know. And why do I say that? It's because of the manufacturing of the doses. Will we see an uptake in the manufacturing? What we know today is that right now we're seeing about 10,000 doses made available to us weekly. And if we ramp up higher at that rate, we're going to be in March looking like, whoa, hey, we're going to fall a little bit short. And so I want to be at that point to where we're able to demonstrate to the state we have our distribution system in a highly efficient manner, and we need more doses allocated to us. But we are not there today. Today, I've got over 20,000 doses in the freezer right now. And so we can't make that ask today, but I want to get this system to a place where I want to be asking for additional vaccines. So very comfortable with the 3,000 today and the 3,000 in 28 days, and we'll see how we progress through this event. Now, this is all based on a 2-dose model. When there is a vaccine that is approved that is 1 dose, and there is one in the works, this changes our framework, right? This really helps our logistics out. This takes that, 1.2 million doses down a lot to meet our 600,000 goal. That just changes completely. That is not on the market today, so my planning can't include that. But once that hits, I would love to do, more mass vaccinations, general population, food and ag with just 1 dose. But that's just not in the playbook at this time.
And that was my very last question, and you kind of answered it, but not all the way, is as an ag association, what can we do to help the county to ramp this up? Because I'm a firm believer with the mess that the state has going on right now, that those counties that kind of take on a leadership role and get this unrolled faster is going to have more available doses to them. So we have a huge interest in trying to accelerate this as much as possible.
Yeah. And so right now, the help I need is for businesses to participate in this project right now. I want to be able to get this pretty much dialed in. We're working on our fairground site, getting that a lot more efficient than what it is today. And so honestly, if we could really show what we do in this project, and then you provide the numbers to me, that guess what, in these industries, we have so many people, and guess what, so many of them have said yes to the vaccine. That is ammunition we can take to say, we have the distribution system, and by the way, we have people wanting the vaccine, and here's the net difference of what we're getting right now. That's the conversation I'd love for us to have in late February, when I feel like our systems will be a lot more efficient, and we'll have a good census in our community, especially within the food and ag. If you could start asking your employees how many of them are ready to get vaccinated, that's going to be a great planning tool, a number for us to be able to go and ask for additional vaccine.
Joe, for the sake of time, is it okay if we save questions towards the end? Because some of the stuff I'm going to go over may answer more of the questions.
Thank you, Dr. Solis. Go ahead, Dr. Solis. Go ahead and take over the slides now. Thank you.
Great, yeah. And then, yeah, if for any remaining questions, if you can type them out on the chat, and then, we can read them afterwards, because, again, maybe I'll go over some of them. So I'm going to share my screen. In order to prepare for this initiative, and even just in general, I created a checklist to help your facilities get ready to vaccinate your employees. The first one is designating either a person or a team to be a vaccine coordinator. And for that, they can help with the following parts of this checklist. The big thing I would say right now for all businesses is really starting your vaccine promotion. And so we're currently, Letty Berber, our PIO, will talk at the end of the meeting about just what we're developing right now to help your businesses promote the COVID vaccine. And also our CBOs, I know some of them are on our call, are also developing materials. Hopefully in the next day or so, we do have some flyers that Wayne Fox will be emailing out to your facilities. And just big things about putting them once you receive them in like break rooms, cafeterias. And then what Joe was saying, a big thing right now is also just trying to gauge like how many of your employees would want them. And if you are hearing that a lot of them don't, we would love to hear feedback from you, like why not? That way that can help our educational campaign. Like, is there certain myths that are being propagated, or is it certain fears? Like we'd love to hear about it so we can develop some of our educational materials. And then this is for the initiative. Like let's say your organization wants to participate in the initiative. Once the date and time is figured out, placing those flyers also in high traffic areas would be very helpful. Another thing, I got this suggestion from the CDC, is consider asking your supervisors, like hosting this event like on site during work hours. Ideally, that way it would increase compliance and, well, not compliance, like the likelihood that they will want to get the vaccine. And then just some logistics for the models. So Joe was talking about model 1, the one where you're like indoor facilities, and 3 for the outdoor workers, is providing a convenient location where it's ideally spacious, offers some privacy if possible. And a reminder, employees should be wearing a mask and stand 6 feet apart while waiting in line to get their vaccine. And after they receive their vaccine, it's protocol that they should be observed for 15 minutes to monitor for any side effects, which are rare, but it's possible. And that's why Joe was saying, you know, the medical personnel are ready to be there in case. And they will be signing their consent. The employees will be signing consent forms before this whole process takes place. And I just wrote in some details, but like Joe was saying, really, we're going to be focusing on the Moderna vaccine, which is 28 days later. For model 2, that's the one where your organization will be paired with one of our federally qualified clinics. And for that one, once we work out the logistics, we will let your organization know. And so your organization will need to coordinate with that clinic for like block dates and time. Let's say, hey, Friday at 3 p.m., we're going to be sending 50 of our employees over. That way they're prepared and can arrange that. For the mobile vaccine, the model 3, what Joe was talking about, the outdoor setting, right now we're thinking like capping that, and Joe, correct me if I'm wrong, about like 100 employees at the moment. And again, as we learn more and from this initiative, we can, obviously we're going to increase that. But we like, if possible, like a paved location nearby. If not, you know, we can brainstorm, maybe put some tarps on the ground, things like that, and in tents to address possible inclement weather. But we understand it's very difficult for some of the workers on the outdoor settings to go to a clinic. So we also want to go to them. So that's what we're brainstorming. Part of the logistics is also collecting information from the employees. So one of our databases asks like that we collect name, date of birth, address, occupation, and if they have any chronic diseases like diabetes, high blood pressure, things like that. And then a reminder, even after the vaccine, everyone should continue with what we call the 3 W's: wearing a mask, wash your hands, watch your distance. Because right now we're still, experts are learning about how the vaccine prevents the transmission. So while we're learning, everyone, even after they get their first and second doses, until we hear from, the CDC, we're going to continue with the 3 W's. So I'm going to stop sharing, and if we can go back to the PowerPoint, Sim. Okay, so next steps, we do have this email, and it was also in our ag guidelines, called the COVID ag. It's fairly simple, hopefully. So COVID ag at Fresno County. So for any organizations that are interested in being part of this initiative, if you can email them and submit the following by January 12th. So I know it's really close, so that's next Tuesday, but if you can give us your name, your address, and just the number of your frontline ag employees that agree. So, and I know it's a quick turnaround, but if your supervisors can ask, just to give us an idea of how many would want it. And of course, we would go through the getting the consent forms and so forth if after the organizations are chosen. Right now, we're discussing that priority will be given to businesses that are having outbreaks, and if businesses are able to meet the logistical criteria that I just discussed, needed to vaccinate their employees. We're shooting to do this during the last week of January, but I think, Joe, you're saying like, we'd be flexible for early February too, but this is kind of where priority is being given. And then next slide. Just to give you all a timeline. So again, if you're interested in this initiative, if you can email the COVID ag, we have multiple people checking it by 5 p.m. January 12th. That's this upcoming Tuesday. And then we have a vaccine planning committee that will look at the emails, and then based off that prioritization criteria that I talked about, and if you're able to meet those logistics, then we will choose them and notify your organization by January 15th. That's next Friday, I believe. And then once the organizations are chosen, our committee will work closely with you with planning these events, and that will be during the week of January 18th through 22. And then lastly, the vaccination events, where with using the 3 different models that Joe talked about, we're hoping to do it the last week of January. And it's also going to be like an educational campaign. We may have, be having a little bit of, well, yeah. So it's just going to be a lot of components with the flyers and so forth, and Letty, our PIO, will talk more about it. But I think that's pretty much it on my end. And Joe, if you want to answer questions, because I know you've been planning the vaccine stuff. So yeah, we can read from our chat, or we can leave it open.
Any last questions that we have at this time before we move on in the agenda?
Yes, good morning, Joe and Dr. Solis. I'm Oralia Maceda from Centro Binacional Oaxaqueño. I feel more comfortable to speak in Spanish, but I don't know. Can I say it in Spanish? Okay. Una de las cosas que quiero decir es de que en la campaña de información sería importante hablar de la segunda dosis que debe de tomar la persona. Porque ahorita nada más estamos hablando de qué es la primera dosis, segunda dosis, pero tenemos que decir por qué, por qué hay que tomar la segunda dosis. ¿Es un refuerzo? ¿Es el complemento? ¿Qué serían ¿cómo se puede decir? ¿Qué consecuencias o qué sería si no toman la segunda dosis las personas?
Gracias, Oralia. Además le voy a decir lo que preguntaste al grupo. So just so everyone understands, Oralia is our one of our community-based organizations member, and so she's just reminding the group that part of our educational campaign should include just the reason why we should do a second dose. And so we will, and Letty, I know I just see you on, she's our PIO. I think we'll definitely take that into consideration.
Yes, Dr. Solis, part of the campaign will be that the importance of the second dose and the age category of when who can get the vaccine. You may have to make that clear as well.
Yeah. Okay. And then Joe, why don't we, because I know there's a lot of questions here on the chat.
Okay.
Okay, we already addressed that, talked about that. Yep. And I think they're just, Hannah, I don't know if you're on, so it says we would like to work with Univision to do a vaccination on there to share information about the process and ease fears for the viewers. Is it possible to film a vaccination or have a clinician? Yeah. So
I can cover that. Yeah, I can cover that, Dr. Solis.
Okay. And then can we get a copy? I think, we'll just clean up any little details, and definitely after we're done, we can send something out. I think those were, any other questions? I think those were the main ones. For Joe regarding logistics and
if we don't have any questions, okay, are we going down the right road? Does this make sense? Is this the road we should be going down?
This is Ryan again. I think so. I think my biggest thing that I would just, we want to see scalability as quickly as possible. I know you guys have limited resources, but if we can be working with whether it's rural clinics and or other partners that make sense for us to help bring in, we will, we're committed to helping to accelerate this as much as possible. So I think right now, finding the volunteers for the 3,000 up front, that should be very, very easy. It's just a matter of how we learn those lessons and how we can scale it after that point.
Okay, and so if so we have all the information on the PowerPoint, we'll get that out to you. There's that email box. If you are interested, please get that to us as soon as possible. We'll start looking, our planning team will evaluate that. We'll choose who we can mobilize with the quickest and really address those three major categories that we're looking at doing. And don't be shy about your number, okay? So I put 3,000 on the table. Let's say you've got something that you can do 1,500 and you wanted to be shy because you want to offer somebody else the other 1,500. Just be realistic on what you think your business is ready to do, what you can do, and we'll deal with how much we can actually offer and see, we'll evaluate that, okay? So please don't let that hinder you from not submitting a proposal because you have much greater need than what's being put on the table today. So if you think of anything, shoot it to that email box. If you're interested, submit that there, and really appreciate the time. And again, so I really appreciate the opportunity of speaking to you all today.
Awesome. Thank you, Joe. Appreciate it very much. Thank you, Doctor. This is Wayne again. One thing that I've been in so many meetings, I don't remember where I heard it, but one of the questions I heard was, if I've had COVID already, do I need to take the vaccine? And the answer is yes, you need to take the vaccine. We have cases where people have gotten COVID a second time. We're still not sure about having that, how the natural immunity works. So you need to encourage, I think, your employees, even though they've had it, to go ahead and get vaccinated again. So I think that's an important thing to keep in mind. And then everybody thinks, well, as soon as I get vaccinated, I'm going to pull my mask off, throw it away, and run wild in the woods. The vaccine's not 100%; it's 90%, 95%. Until we get that herd immunity, it's still probably prudent to keep that mask and keep that on. So anyway, I've asked Letitia Berber, who is our PIO, and she has been working on quite a few different things. I mean, she's got a lot on her plate, but this has come to the forefront here about how to get the word out, public outreach on vaccinations, and she's been working on a lot. I asked her to share a little bit of what we have and what's coming down the pipe. So you got that for a minute, Letitia?
Yes, I have. I don't have PowerPoint slides like Joe and Dr. Solis. But first I want to introduce Amanda Franklin, who is the Corporate Compliance and Safety Manager from Harris Ranch, who has joined the group, and she has included some questions on the chat box. So welcome, Amanda. I think you'll be a perfect fit for this group. First, like Joe mentioned, the phases of the vaccine. I know everybody's wanting to see that and to see where their employers fall, what category they fall in. So we are working on an infographic. Actually, it's already completed, an infographic on those phases. They will be available on the website as soon as it gets approved. We're hoping for it to be approved before the end of the day, and you will see it on the website, the link I put on the chat box for everybody to see. That is the link to COVID vaccination information for the public. We also have a page for COVID vaccination information for medical providers, but I just went ahead and provided you the link to the public information website. That's where you're going to see the infographic on the vaccine phases. As soon as that is completed and approved, we will share those with our community-based organizations. That way they can start crafting messages for their target population as well. Part of the project that Joe's working on and vaccinating those 3,000 individuals is to create a flyer on what to expect after you get vaccinated. So I think it's very important for people to understand the side effects, and just because they have side effects, it doesn't mean they got the COVID illness. And also the importance about keep wearing the mask and keep the social distancing. Just because you got vaccinated doesn't mean you're, like Wayne said, it's okay. So we're gonna go ahead and include that message on that flyer. The flyer's in the works right now. As soon as it gets approved, we'll share it with Wayne. That way he can share it with you all. We are also planning on posters and templates that you can use. That way you can just add the time and day of those events that you'll be hosting at your site. So we'll share those with Wayne. That way he can share those with you. And as soon as they get approved, again, we're going to try to make them colorful and attractive for your site as well. So we're working on those right now. And yeah, so once that vaccine phases get approved and posted on the website, we are planning to do a news release on that and a health advisory for providers, because providers are also asking for that. And that way they can use that as a tool to guide their patients on where they fall in what category and when they're going to be expecting their vaccine. In regards to the question that Hannah had about Univision, inviting Univision to our vaccination sites, yes, we are planning. Again, we have to get approval from Dave and Dr. Bora to invite the media to our pilot project. And yes, we're going to go ahead and really emphasize the importance of the vaccine and the safety of the vaccine as well. So Univision will be one of those. as soon as I know interviews, we do get invited by Univision and other media venues to talk about the vaccine. So we do touch upon that as well. We did receive a request from Radio Bilingüe, who they want to discuss the agricultural industry COVID-19 safety guidelines that Dr. Solis created. So they want to do a half-hour show on that. So I don't know if Tom or Dr. Solis can be guest on that radio show and talk about those guidelines. So Hannah, yes, we are planning invite the media, and usually Univision attends those events as well. So there lots of planning in regards to media, lots of planning on how to inform the public coming up, and you'll be hearing from Wayne as soon as those creatives are done.
Awesome. Thank you, Letty. Thank you very much. Any questions for Letty about outreach? Awesome. Thank you. The kind of the last thing I want to talk about, I know it's been a long Zoom meeting, but AB 685 requires reporting of employees that have, that have tested positive for COVID, 3 or more over a 14-day period as an outbreak, and there's required reporting. We are very close to coming up with a digital reporting tool where you can go online. We will have that link available. We hope to have had it available first part of this week, but a couple little hiccups slowed us down, but we hope to have that really soon and have that available. If you want to report now, you can still report directly to our COVID Ag at FresnoCountyCA.gov, and we will make sure that data gets entered. We will have that, and as soon as I have that available, we will get that out as soon as possible. But there will be an online way to report, list your employees that have been sick, and to meet the state requirement. That we should have that very shortly. We've been working on it all week. With that being said, if anybody has any new topics, email me, let me know, send them to me. We are interested in talking about it. We're trying to make sure that we don't waste anybody's time. We want topics that meet everybody's interests. So if there is something you want to discuss, let me know. I appreciate that. And with that, do we have any questions? Any questions anybody wants to ask?
Wayne, maybe also just mention about the Cdfa testing, still available.
Cdfa testing, Cdfa is providing testing for farm workers. It's a self-administered test. You can work through a CBO or a lab. The CBOs, we have at least one CBO that is using that testing, and the testing is free. And if you can get that testing, there are very limited hoops to get it, but as an organization, you can get it. There's a process to get connected to the software, the reporting software, and there's some videos to show you how to do it, but it's a self-administered test. So basically, you as a CBO, what you are doing is you are obtaining the test kits, bringing them to the people. They do the testing themselves. You're making sure they're logged in and registered, and then you're making sure those tests, once they're done, again, self-administered, are routed back to the lab in Valencia. And the testing and the processing of the test and all of that is free. So something to be thinking about. Anyway, if there's no questions, I always contact. We are always available. Love to hear from you. And I wish you guys a good weekend and take care. Thank you.